We are learning more now about the Omicron variant from scientists in South Africa, where it was first reported. An early study there found Omicron is at least 2.4 times more likely to reinfect someone who had COVID before compared to other variants. The strain is also highlighting inequalities in the global COVID response. Debora Patta is in Johannesburg. Deborah, good morning.
Good morning. In the turf war between Omicron and Delta, the new variant is clearly winning, accounting for a meteoric rise in new infections in South Africa, and it's inserted itself firmly into the global debate on vaccine inequality.
It's been the war cry of health experts around the globe since the pandemic began. Nobody is safe until everyone is safe.
Had we done the scientific thing, had we done what the scientists were saying in January, February 2020, we would not be now where we are.
And what science tells us, says a furious Dr. Ayawade Alakija, is that unless there is global vaccine equity, the virus will continue to mutate. In the two countries where Omicron was first identified, Botswana has already administered 86% of its supply, South Africa 78%. Compare this to wealthy nations where it's predicted 100 million expired vaccines could be destroyed at the end of the year. This is because they've hoarded them, says Alakija.
We're saying get out of the queue so that we can get to the front of the line and get our own and pay for them.
Complicating matters further is distribution. Many African countries lack the logistical capability to get shots into people's arms, and travel bans only further isolate this region. Californian Monica Glass was visiting her husband's family in South Africa when her flights were cancelled.
Southern Africa is the only place who they instilled these travel bans, right? And I feel like it's unfair. It's not right.
Then another blow. While waiting to make new travel arrangements, she tested positive for COVID and is isolating in Cape Town.
I have mild symptoms. I am vaccinated and I'm a nurse, so I work in a COVID unit. I've been around COVID, and this is the first that I've had COVID as far as I'm aware.
A far bigger concern is getting home to her 3 children when the infection clears.
Travel bans are causing further chaos, with South African scientists saying there are fewer planes coming in that can bring the necessary compounds to study Omicron, sparking fears they could run out.
Debora Patta in Johannesburg, thank you very much.